As a commissioner on the Board of Health, it is really to keep apprised of what's happening within the city of New Haven, things that impact people's health and well-being, to advise the Board of Health on initiatives and or the director of the Board of Health on initiatives that can improve outcomes and prevent illnesses. And so it's really to support the efforts of the health department. The focus of the commissioners of the Board of Health at this time is really to address the health status of New Haven citizens, how health matters, and we need to be able to get input from all levels of the community, from all walks of life, as to what we need to have happen in New Haven to promote health and well-being. There's still some things that need to happen, both for us to feel as a community, and not that we're from different zones, but that we're all in it together, and it's not just about my neighborhood, it's about all of us, and that we've got to come together and do something and do it more constructively. We've got to get people engaged and to see it as an important part of our lives, because if I can change my neighborhood or the neighborhood of New Haven, one house at a time, eventually we're all going to feel better. There is a better sense of community. But if we can start to treat each other as family, as friends, that we can make a better place for us all to thrive. It's hard, because people tend to be a little bit leery, but I think we've got to move beyond that and realize that the health of our children here is at risk, and the next generation is not going to get there unless we do something now to help them on that way. The Board of Health's vision for a healthier New Haven in the next 5 years is to see a decrease in youth violence, if not complete elimination of it, that we see people exercising and doing things to maintain their health and well-being, that folks, so the obesity issue would be less. Type 2 diabetes, particularly in our young people, is just, that's not the way to go. We're talking about long-term kidney damage, heart damage, and if you're starting that early, you're going to end up, with serious kidney failure and other problems, much earlier than most people who get it, type 2 diabetes, later. And so my vision is to see some of those things I think we can wrap our hands around and change, do that very quickly, and create safe environments where kids can feel comfortable about walking out of their houses and getting out, meeting and greeting friends, and being friendly, and not have to dodge the bullet and have to be fearful. Because fear, when you're fearful, when you have fear that's pervasive, it stresses you. And we're talking about coronary artery disease, we're talking about a whole lot of other stressors that can damage people's health. And so we've got to give people that, we're not all going to be stress-free, but we have to give people at least some of the stresses that we can minimize, and if not eliminate, that people can have healthier, at least cardiovascular health and mental health. So that's, I think our goals are to see us light years ahead in terms of tackling some of our problems as far as youth violence and definitely in obesity.